If you're on food stamps and EBT, pay attention. I have 4 major changes that are going to affect your benefits and news updates that you need to know about. So stay tuned. So here's what I want to talk about. I have 6 EBT discounts that you should be using that you're probably not using. I'll give you full details of how to take advantage of these discounts. And then I'm going to give you the November 2024 food stamps deposit schedule for all 50 states. When are your food stamp benefits going to hit your bank account, your EBT account? I want to give you all the details so that you know specifically what's happening in all 50 states. And then most people on Social Security have been thinking about food stamps, and there are a lot of people on Social Security and disability who are on food stamps. So I'm going to give you the Social Security cost of living adjustment that has been announced, what the amount is going to be. If you are on Social Security or disability, or you know somebody that is on Social Security or disability, pay attention at the end of this video, because I'm going to tell you how much they're going to get in benefits starting next month. And a lot of people are disappointed, so you want to see what those changes are and what the 8 changes to Social Security in 2025 are going to be. That is going to affect all 74 million people on benefits. So let's start with the big news. 6 EBT discounts that you aren't taking advantage of that you probably should. The first one is the Double Up Food Box program. The Double Up Food Box matches your EBT dollars, so you get twice the fruits and vegetables you buy at farmers markets and selling grocery stores. Double Up helps you bring home more healthy food by matching your SNAP or food stamp dollars spent on fresh fruits and produce. If you receive SNAP benefits, you're automatically eligible for Double Up Bucks. Currently, they are offered in more than 900 locations across the country, from farmers markets to grocery store. So basically, if you buy $20 in produce, you get $20 in produce free. There is no way you can beat that. So to find a participating Double Up Food Box location near you, visit doubleupamerica.org. In some states, it's called something different. So on the website, once you visit the website, select your state, and they'll tell you if they have a Double Up Food Box program in your state, or whatever the equivalent is in your state, they're going to tell you. So visit eligible locations to receive Double Up benefits. Some of them match up to $30 per visit. Not maximum. They match you $30 per visit. So it is a really, really big program that has saved people a lot of money. So it's a no-brainer. The second discount is the Lime Access program. Lime Access provides discounted e-bikes and e-scooter rides to those with limited income. The goal of the program is to provide sustainable and affordable transportation to more communities. To date, they have served over 1.8 million trips on Lime Access. Transportation can be expensive, and Lime is working on a solution to help with that. To qualify, you must provide a reason for your eligibility, your name, your email, birth date, and phone number. And your reason for eligibility could include one of these government programs, whether you're on food stamps or EBT, Medicaid, reduced rate utility bill or care in California, reduced or free school lunch program, reduced transit fare program, Social Security supplemental security income benefits, special nutrition program for women, infants, and children, which is called WIC, federal subsidized housing, and Pell Grants. These are all programs that, if you are eligible for or currently receiving, makes you qualify for the Lime Access program. So to qualify to get discounted e-bikes, e-scooter program, Lime Access, go to their website at lime.site, or you can call 1-888-495-5014 to unlock the bikes. For riders without a credit card, once you are qualified, you'll receive a Pay Near Me payment code to help you be able to unlock the bike. The second one is the National Diaper Network. The National Diaper Network provides basic necessities required to build strong foundations for all children, families, and individuals that need it to thrive and reach their full potential. 1 in 2 families in the United States struggle to get diapers. And the National Diaper Bank Network wants to fix that. They work in partnership with your local diaper bank, allied programs, donors, sponsors, and elected officials to end diaper need and period poverty in the United States. The National Diaper Bank Network supports the country's more than 225 community-based diaper banks that collect, store, and distribute free diapers to struggling families. The network serves nearly 280,000 children throughout the country each month. If you need free diapers, visit a local National Diaper Bank Network community organization near you. To find out which location is near you, go to the nationaldiapernetwork.org/member directory, and it will give you the list of organizations that are in your local area. The third program is Laundry Love Service. Laundry Love is a nonprofit that provides free laundry to low-income families. They help wash clothes and beddings for low-income families and individuals across the United States for free. They brighten the lives of those who don't have access to laundry services, and they believe that they're doing that through love, dignity, and detergent by partnering with diverse groups of laundromats nationwide. The Laundry Love Initiative helps people struggling financially by assisting them with their laundry. To get access to a free laundry service, find a Laundry Love location near you. To do so, go to their website, look at their directory, and put in your zip code or city to find a location near you. Go to laundrylove.org/location. The next one is Lyft. I already talked about Lime. I'm talking about Lyft. Lyft has a program called the Lyft App Access Program. Millions of people lack access to basic needs because they cannot get a ride. The Lyft App initiative is working to make sure everyone has access to affordable, reliable transportation to get where they need to go, no matter their age, income, zip, or postal code. They are currently offering the following programs: job access, grocery access, bike share access, voting access, disaster response, and access alliance. To qualify, you must provide your reason for eligibility, your name, email, birth date, and phone number. The reasons for eligibility includes qualifying for one of these or receiving one of these government programs: SNAP food stamps, Medicaid, reduced utility bill, free or reduced lunch program, Social Security supplemental security income, WIC, federal housing program, and Pell Grant. So you need to access these benefits. If you are accessing them already or are eligible for them, it means that you may be eligible for the Lyft app program. So to continue, let's see how you can get access to this. To date, they have provided 4.6 million discounted or donated ride, bike share, and scooter rides for underserved families. To participate, you have to visit their website. Go to lyft.com/liftup/programs. The last one is the Vision of Eyes program. VSP Vision of Eyes provide access to no-cost eye care, eyewear, and disaster relief in places where it's needed. VSP believes that eye care is essential. Eyes of Hope addresses barriers to income, distance, and disaster to provide equitable access to eye care and eyewear where it's needed the most. To date, they have provided access to 3.8 million eyewear and eye care services for free to those in need. If you can't access affordable eye care for adults or children, you can get free eye exam and eyeglasses at no cost. Eyes of Hope also offers gift certificates. Now, I've heard that they may not be offering gift certificates anymore in some areas, but they provide gift certificates, mobile clinics, and disaster relief to those in need of eye care to anybody. To qualify, you have to have an income up to 200% of the federal poverty level. You do not have coverage currently through a private insurance or a government program, and you haven't received a VSP program in the last 12 months. Now, I'm talking about gift certificates. That is the only thing that people have reported back, that they may not be offering it all the time, but they do offer them. They offer mobile clinics, they offer disaster reliefs, and so all you need to do is find a local partner, and here's how. Basically, if you are a student through age 19, contact your school nurse. They will reach out to a VSP partner to get help. If you're an adult, contact one of their community partners to get help, to get services, free eyeglasses, and free eye care exams. So visit their website, vspvision.com/eyes of hope, or call them at 1-800-877-7195. So let me know what you think about this discount. Is there any particular one that caught your eye? Is there any particular one that you were surprised about? Which one are you going to take advantage of? Let me know in the comments. And also, if you haven't subscribed to this channel, please hit that subscribe button. All we do is bring you good updates, news, tips, discounts that could save you money, and most importantly, anything in and out of Congress that will affect your food stamps or EBT benefits, we bring it to you. Let's talk about November 2024 food stamp deposit dates. When are you going to get your food stamps? Well, let's talk about that. Now, it is not that we don't know that food stamps are very important to millions of people. There are 42 million people on food stamps. An average member, 5-family member, gets $1,158. A family of 5, average gets $845. So what I meant was that the maximum benefit for a family of 5 is $1,158. An average family of 5 gets $845. Benefits have increased due to the cost of living adjustment, which went into effect on October 1st, 2024. So let's look at when your benefits will be paid. If you're a family of 1, your maximum benefit is $292. If you're a family of 2, it's $536. If you're a family of 3, it's $768. If you're a family of 4, it's $975. If you're a family of 5, it's $1,158. If you're a family of 6, it's $1,390. If you're a family of 7, it's $1,536. And if your family of 8 is $1,756. That's the maximum benefit. Your average benefit or your personal benefits that you get depends on the income for your household and other factors like the number of people in your household. So let's look at the payment dates. Usually food stamps are paid between the 1st and the 28th, but depending on your state, the payments vary. Some states paid on a single day. Some states paid staggered over a period of time. So the single day payers, Alaska pays on the 1st, New Hampshire pays on the 5th, North Dakota on the 1st, Rhode Island on the 1st, Vermont on the 1st, and the U.S. Virgin Islands on the 1st. Between the 1st and the 10th, California, Colorado, Connecticut, Idaho, Illinois, Iowa, Kansas, Nebraska, Nevada, New Jersey, New York, Oklahoma, Oregon, South Carolina, Virginia, West Virginia, Wyoming, District of Columbia, and Guam all pay between the 1st and the 10th. So the date that you see is the period with which your state pays the benefit. So for example, California pays between the 1st and the 10th, Connecticut between the 1st and the 3rd, Nebraska between the 1st and the 5th, and West Virginia between the 1st and the 9th, and Oregon between the 1st and the 9th. So that is the schedule for those who pay between the 1st and the 10th of the month. Next, we have those who pay mid-month distribution. So they pay between the 1st and the 15th. Arizona, Arkansas, Hawaii, Maine, Massachusetts, Minnesota, Montana, Pennsylvania, South Dakota, Utah, and Wisconsin. So as you can see, there's a mistake in some of my data here. I need to move some of them to the other slide. But here we are, but you get the point. So Arizona is going to pay between the 1st and the 13th, Arkansas between the 4th and the 13th, Maine between the 10th and the 14th, Massachusetts between the 1st and the 14th, Wisconsin between the 1st and the 15th. And then those who pay between the 1st and the 20th, you have Alabama, Delaware, Florida, Georgia, Indiana, Kentucky, Louisiana, Maryland, Michigan, Mississippi, Missouri, New Mexico, North Carolina, Ohio, Puerto Rico, Tennessee, Texas, and Washington. Those pay between the 1st and the 20th plus. So that's the food stamp distribution schedule. Let me know. Your state has a specific schedule based on what I've told you. And so check with your state agency. Obviously, you have to be receiving food stamps to get it. Millions who qualify don't get it, especially seniors. 50% of seniors who are eligible for food stamps have not applied. And that is something that is a missed opportunity, because if you're a senior, you need the money applied, because you're not taking benefits away from anybody by applying. if you apply and you're eligible, you're going to get the money. You're not taking money from anybody or denying anybody benefits if you apply. Again, if you like what you hear, I want you to hit that like button, hit the subscribe button, because we want to grow this channel. We want more people to hear about what we are bringing to you and the important information we're sharing. We want it to spread wide. So let's talk about Social Security cost of living. The government announced it is 2.5%, and a lot of seniors are mad. Why? Because cost of living is still high, and to have a 2.5% increase for next year is kind of very depressing for a lot of people. But here's the thing. This is not surprising because the government says Social Security, the inflation index have been coming down. Inflation have been coming down and trending down. So the government, it makes sense that the cost of living for Social Security adjustment will also trend down. But that does not mean that people are not struggling, because over the last few years, we've become used to getting higher Social Security cost of living adjustment. 2022, we got 5.9. 2023, we got 8.7. Even last year, which went into effect this year, was 3.2%. So how does that compare historically? Well, if you look at before COVID, it's been pretty low. 2021, it was 1.3%. 2020 was 1.6%. 2017, it was 0.3%. 2016, it was 0%. So COVID really changed the game because of the high inflation. So maybe the cost of living adjustment is returning to where it was before. But to understand why people are complaining, a lot of people are saying that COLA, cost of living adjustment, has not caught up to inflation. And there's data to prove that that is actually true. But I think that they are blaming the wrong thing. It is because the index that the government uses to calculate COLA, a lot of people are saying it is not a good reflection of the cost that seniors face. So what they do is that they use something called the Consumer Price Index for urban wage earners and clerical workers. And what it does is it tracks everyday items like food, housing, medical care, transportation, energy costs in urban areas. It looks at the third quarter, July, August, September of a year, and then compares it to the previous third quarter. And if prices have increased this year, then your Social Security is adjusted up. If prices have gone down, then your Social Security remains the same. So what people are saying is that this is not a good reflection of the cost of seniors, because an index that tracks urban wage earners and clerical workers' cost of living does not typically reflect what cost seniors face themselves. So some lawmakers are suggesting a new cost of living adjustment index called the Consumer Price Index for the elderly, which will measure changes specifically based on spending patterns of Americans 62 years and older. So there are two bills before Congress right now, the 2023 Fair COLA for Seniors Act and the Social Security Expansion Act, that is supposed to help address these issues. So what do you think of the video so far? If you like it, hit that subscribe button, hit the like button so that more people will get to see this video and this critical information that I'm bringing to you. Now let's talk about the 8 changes to Social Security that is going to affect everyone this year. The first one is how much you're going to get. If you are receiving Social Security, your average benefit is going to be $1,976, an increase of 49 whole dollars. That doesn't even fill a gas tank these days. Social Security as a couple, if you're a couple receiving Social Security, you're going to get $3,089 on average. If you're on SSDI, you're going to get $1,580 on average. If you're on SSI, you're going to get $967. That's the maximum benefit, an increase of $24 this year. And if you're a couple receiving Social Security SSI benefits, you're going to get $1,450. That is the maximum. Another change is how much you're going to get at full retirement. It was $3,822. That was the maximum you could get. It's going to be $4,018 in 2025. Now, if you're paying Social Security taxes, that is how Social Security is funded. Each year, the amount that you can make to be taxed is changed based on the cost of living adjustment. In 2024, that amount was $168,600. It means that if you make up to $168,600 a year, you're going to pay Social Security and Medicare taxes. Well, in 2025, it's going to be $176,100. And then if you're on Social Security disability, you're familiar with substantial gainful activity. To be eligible for Social Security disability, a person must be unable to engage in what they call substantial gainful activity. A person who is earning more than a certain monthly amount is ordinarily considered to be engaged in SGA, and the amount of monthly earnings to be considered as SGA depends on the nature of the person's disability. So every year they change that amount based on COLA. So for the non-blind, 2024 it was $1,550. In 2025, it's going to be $1,620. For the blind, it's $2,590 a month. In 2024, in 2025, it's going to be $2,700. Now, if you're on trial work period, you're on disability benefits and you're trying to get back to work and you're working, the limit for you is $1,110 this year. Next year is going to be $1,160, an increase of $50. Why is this important? Well, you could lose your Social Security disability benefits if you are working and making more than that for an extended period of time. So they release these numbers to make sure that you know what the threshold is and what they are looking for and what they consider as substantial gainful activity. The next change next year is going to be Medicare. Medicare Part B premium that is taken out of your Social Security check is going up to $185 a month. And the maximum allowable out-of-pocket cap for Medicare Advantage plans will increase to $9,350. In addition, Medicare Part B deductible is projected to increase to $257, and in Part D, your deductible is going to increase to $590, but Part D donut hole, which is something that a lot of seniors worry about, will no longer exist. And then in Medicare Part D, your out-of-pocket costs will be capped at $2,000 for covered drugs. If you're claiming Social Security before your full retirement age, here is something you need to pay attention to. If you're working, if you make more than $23,400 next year, for every $2 you go above that, you will lose $1 in benefits. If next year is your full retirement age, you're collecting Social Security, you're working, you can work up to $62,160 and you will not lose any of your Social Security benefits. But if you make $3 more than that, for every $3 you lose $1. The year of your full retirement age, if it happens to be next year. Once you reach full retirement, you can work as much as you want and you will not lose any benefit. And for those who are trying to qualify for Social Security, you need 40 credits a year total to get benefits. And you can get 4 credits a year maximum. So it takes 10 years to qualify minimum for Social Security. Each credit is worth $1,800 per quarter. So you have to make $1,810 in 2025 to get 1 credit. That's the minimum you have to make. It was $1,730 this year. Lastly, Social Security taxes. As I told you, if you make up to a certain threshold, you have to pay Social Security and Medicare taxes. That rate is 7.65%. This year, it doesn't change next year. If you're self-employed, you're going to pay twice that, 15.3%. So those are the changes that I wanted to bring to you today. If you like what you hear, please hit the like button. If you haven't subscribed, hit the subscribe button. I'm preparing another great update for you next week, or even later this week, actually. So until that video comes out, if you have any questions, let me know in the comments. Until then, thank you for watching this video.